This measure, SR 9, reaffirms that the California State Senate stands in strong support of Planned Parenthood and opposes all proposals to defund this critical health organization, to limit its ability to serve its clients, or to appoint judges who oppose equal health care rights for all women. This resolution further states that the California Senate is resolved to work with stakeholders to ensure that our representatives in Congress hear and understand that we are firmly committed to women's rights, their health, and the opportunity to exercise their fundamental rights. Planned Parenthood is a health care provider that serves nearly 1 million women in the state of California. At centers throughout the state, there are 115 Planned Parenthood centers in the state of California. And at a time when health care is having such a challenge because we lack the number of resources and individuals and providers and clinics, the notion that we would defund one of the most critical providers of health care for low-income people, and particularly low-income women, is absolutely unacceptable, let alone unfathomable, at a time when health care needs are as great as they are and are yet still underserved. And the notion that there would be other places people could go is just a fallacy. We don't have enough providers as it is. When you take away 115 providers who provide over 1 million services a year, you are just simply digging a hole deeper. Now, Planned Parenthood provides comprehensive health care services to both men and women, 97% of which is comprised of women examinations. These are preventative health care examinations, birth control, testing and treatment of sexually transmitted infections and HIV, pregnancy tests, life-saving cancer screenings for both men and women, sex education, prenatal care, and primary care services. 2/3 of those services, by the way, are federally funded. For women in their child-rearing years, protecting health care and choice is not only morally right, it is also a matter of economic justice. In many ways, choice has become untenable without the option available, because nearly 50% of women today are working outside the home, and they are working outside the home to support their families. 40% of households with children under the age of 18 are supported by mothers who are the sole or primary providers for their families. Yet, we lack quality, affordable child care. The average cost for child care in California today is over $13,000 a year, more than the cost of tuition at a University of California. If you are in a situation where you cannot access affordable care, and you are pregnant and working and the sole provider of your family, you do not have any choices available to you. Clearly, this is an issue not only of what is morally right, what is fundamentally right, but is of economic importance as well, as people try to plan their futures and what is best for them, and most importantly, for their families. The ability of Planned Parenthood to exist and function is essential to ensuring that every woman has the right to make her own decisions and control her own destiny. That is what freedom and responsibility are all about. And yet, despite these invaluable services, life-saving in many instances, the incoming administration has repeatedly threatened to defund Planned Parenthood, as has the Republican-controlled Congress. As we face the inauguration of a president who was elected by a minority of the people and a Congress that has been rigged by gerrymandering, We find ourselves in California, a state where the people, by a total of 4 million, voted not for the president who is about to be sworn in, but for his opponent, by over 4 million Californians. It is incumbent upon us to accept and to follow through with the responsibility that our constituents, that this state has, that is calling for access to reproductive health care for all women. Our state already suffers a shortage of providers. We need this wonderfully effective service that provides health care to 1 in 5 women during their lifetimes. 20% of all women, and we know many men, are able to and have accessed these services for their health care. We cannot turn a blind eye to this critical need, and now more than ever, California must lead the nation in protecting women's rights and women's health.